Okay, welcome back, everybody. You know, ladies, I want you just to pause, stop for a moment, and think about you for a second. And the reason why I say this is because May 12th through the 18th is Women's Health Screenings Week. And it's where we have to kind of make our health a priority. And sometimes we don't do that. Joining us this morning to tell us more about this is DO, Dr. Angela DeRosa, who is the medical health expert. And as always, thanks so much for coming. It's always such a treat to have you on the show.
Always a pleasure to be here with my favorite people.
Regarding this Women's Health Screening Week, tell us about this. What's going on?
Well, it's a moment, as you said, to take pause as women and take inventory of our own personal health. We are experts at taking care of everybody else and controlling and manipulating our children and our spouses and our partners, but we very rarely take that moment to have that same kind of fire toward ourselves. And it's important. This is that week to really focus in on me, you, us, and taking care of ourselves and do those things that we should do to be preventing the illnesses down the hall.
Like you said, we run around, we take care of everybody else. I mean, I get, reprimanded all the time at home, you're not ready yet, or I'm putting my makeup on in the car, or I'm still trying to get ready as I'm heading out the door. That's because everybody else is dressed and ready to go out the door.
Yep, we are the caretakers. We caretake everybody around us, except ourselves.
Top to bottom, exactly. There are certain screenings that women need to pay attention to and do at certain ages in their life.
We're very, very good about thinking about pap smears and the mammography because certainly cervical cancers, when caught early, are curable. So, same with breast cancer. The data is so good now and the research is so good that if caught in early stages, breast cancer is curable. So as women, we focus in on those things, but actually cervical cancer, breast cancer, all those scary things aren't the things that kill us most often.
What are they?
Heart disease.
Oh,
our hearts, we die of broken hearts all the time, literally and figuratively, but when we look at the #1 killer of women, it is coronary artery disease. And it's a simple way to screen for it. When we hit 50, and sometimes sooner if we have other risk factors such as diabetes, high blood pressure, high cholesterol, but everybody at the age of 50 should just have an EKG, which are these tiny little patches that we put on your chest, and what it does is it measures the electrical activity of your heart to see if your heart is pumping well, it's got good electrical conductivity going through it, and working properly. It's a simple, painless test that you should have yearly starting at the age of 50.
And then colonoscopies too.
The dreaded colonoscopy.
Yeah,
nobody likes the idea of the colonoscopy, but actually the
test, you have to do it.
The test itself is actually very, very simple. They knock you out, you get a little Versed, which everybody loves Versed, so you forget the procedure. It's the prep that everyone fears, is having to clean out the gastrointestinal tract. You have to take a day off of work, so it's a little more daunting. But it is so important. Colon cancer is really prevalent in both men and women, and especially if you have a strong family history, get screened. Our diets are terrible, our environmental exposures are terrible, and it creeps up in that colon. Starting at 50, colonoscopy.
Okay, and going back to the EKG, if you have a family history of the heart disease, with any of these, do you wait to 50, or would you go sooner?
Not
and
necessarily.
Do baby aspirin help something like this?
Baby aspirin in the proper patient, there's certainly, if you have risk for bleeding, you need to talk to your doctor about that. Can be helpful to lower the platelets in the blood that stick that can cause those heart attacks. But we're talking generalities here. 50 is the average age for colonoscopy start and average age for EKG. But if you have other risk factors, so for instance, let's say your father or mother has a lot of colon polyps or has an earlier history of colon cancer, say in their 30s or 40s, we're going to start screening around that time frame as well. Or if someone comes in and they're markedly overweight, has high blood pressure, I'm going to do an EKG in their 30s or 40s and not wait till 50.
Okay.
So you need to individualize, but at the very least, when you're talking bottom basement dollar screening, 50 is a good age for EKG, good age to start colonoscopy. Pap smears, obviously, we start at the age of 21 in women, and then the mammography, we start a baseline in the 30s, starting at the age of 40 every other year, and then annually at 50.
Okay.
Again, if you have certain risks, we might do that a little more aggressively, but those are the basics. The other thing we often don't think about, too, here in Arizona, skin cancer.
Oh.
You need to, when my patients come into my practice, if they're doing
a
well
age
woman.
spots all over them. It's like, wait a minute, you shouldn't be having those yet. You're only like 33.
But these cancers are killing women, young women. I've seen 20-year-olds who die from melanomas because they've sat in the sun or had those tanning bed exposures. A woman walks into my office and has her well woman, so her annual pap smear, she is going to take a gown on and she's going to stand in front of me naked, and I'm going to look at her skin, front, back, bottom of the toes, behind the ears, everywhere. It is simple to do, but it can be life-saving, and that should start right as teenagers.
Well, and with the sunscreen protection, you hear SPF 20, 30, 50. I mean, is there especially for women, is there a baseline of what you suggest of what we should use every day?
Well, certainly every day you should make sure your makeup or yours has some kind of sunscreen on your face and chest, especially as we're driving around in the sun here. A minimum of 30 SPF. Some of them go up to about 50. When you get above 50, they really don't work much better than the 30s and 50s. But just having a good basic sunscreen on is helpful, and then stay out of the sun. We talk about getting vitamin D from sun exposure.
Right.
But I'd rather see someone take the
that.
supplement of vitamin D and protect their skin and get that sun and that vitamin D from somewhere else and prevent those melanomas from occurring.
And quickly, a bone density test.
Yes.
Women with the calcium and all that other fun stuff that comes with
Again,
that.
another test that you want to start thinking about it typically in the 50s as women move through the menopause. Once a woman is menopausal, they start to lose bone about 5 to 10% a year once we lose our estrogen and testosterone. That is going to be a very aggressive bone loss time, and that's when we want to capture and get that bone density. It's a simple test. You lie on a table. There's really very little radiation. You just stay in your clothes. It measures your hip and your spine, and it tells us, have you lost bone, and are you at risk for fracturing down the road?
It's that simple.
It's very simple.
Thanks for joining us this morning, and letting us take charge and make our health a priority.
It's
we appreciate
important.
it. It's very important, because if mom's not healthy, then nobody else can be healthy and happy.
Happy and healthy.
Exactly.
Mama
Thank
happy.
you. Happy Mother's Day. And happy Mother's Day to you too. We'll be right back.